And action. Eve had a question about iliotibial band syndrome, and if you check out my video on YouTube, DrRic tutorial ITB syndrome, you'll see the stretches that I teach in yoga class. But for the most part, this usually affects runners and cyclists because those two sports are very repetitive with their extension and flexion, the gait movements. And when you have a leg, and here is my acupuncture guy, when you have a leg that has hamstring in the back and quads in the front, so that these muscles don't have to insert straight to bone, you have this connective tissue, this part here. This connective tissue is all, if you look at some images on Google, you'll have just white tissue, red muscle and white tissue in between. It actually is connective tissue. Also connects up here to these obliques and the build back here to the gluteus. So the idea is when you have this tissue and it's excessively tight, it's going to compress the things on the lateral side of the outside of the leg. And that's not a big deal unless you have a protuberance, like a bony protuberance. And there's something called a trochanter right here. It's the hip, or the outside of the hip bone, and something over here called Gerdy's tubercle at the knee. They're prominences. And sometimes if you have that prominence stick out more than the average person, then no question when you go back and forth with the running, the band is going to have to click past here. And if the band is tight and the protuberances are large, you're going to have friction. There's usually a little sac of fluid between the band and the protuberance, but sometimes that sac of fluid, which is supposed to be lubricating, it can actually be with repetitive work, it can be irritated, and the irritation causes more fluid to accumulate. So suddenly the kind of small liquidy sac becomes a big golf ball. There is no room for golf balls on the side of the leg. So that's when the band gets pushed out and that hurts. It becomes more of an obstruction, and then you continue with running, it'll become even more irritated and painful. It's the body's way of saying there's something wrong, stop running. Until eventually it gets to the point where you just can't walk anymore, or can't bend your knee, or can't bend the hip. So this is Gerdy's tubercle, this is the trochanter. Now both of those points can cause pain. You can have iliotibial band present as pain in the hip, iliotibial band present as pain in the knee. And what's also kind of cool for me as a pathologist, or at least as a kinesiology doctor, if this is irritated down here, Gerdy's tubercle, and there's inflammation, it'll actually pull the kneecap over. So if we pull the kneecap over, then the kneecap won't track right. If it doesn't track right, it starts to rub and you have kneecap pain. Typically it's called patellofemoral syndrome. A lot of runners will get it, a lot of adolescents that are growing will get it. But it will snap, it'll crack, and it'll cause friction and pain. It'll have you'll be practicing theater leg is what I call it, because if you're in a theater, you'll pick the aisle so you can keep your legs straight. If you keep your legs straight, the kneecap doesn't hurt. If you bend your knee, the kneecap comes in contact with the bone underneath it and it hurts. So people that walk like they're limping, or they keep their legs straight in the aisle or under the desk, usually it's because of patellofemoral syndrome. And in this case, the ITB, or IT band irritated and being excessively tight, is the cause of PFS. So whenever I send people to physical therapy, yeah, you need physical therapy. If it doesn't go away with anti-inflammatories, relative rest, meaning cutting down on the repetitive activity, icing, and stretching. Stretching is tough when it comes to an IT band. That's why instead of, if you see my video on Theracane use for trigger points back here, well, it's hard to Theracane this. So if you ever go to the running stores, you'll see them roll it. So rolling this thing will get it so that it kind of breaks the connective tissue stiffness and the fibrosis. But man, is this painful. Usually you'll see people kind of lie on the ground and roll on these things. That hurts. But it's a good kind of hurt, because after you're done tolerating the pain, your IT band is looser. There are exercises to do that also work on stretching. Again, if you see my video, you'll see what I talk about. If you can't do them on your own or can't tolerate them, then actually I've given patients pain control medicine to do before they go to physical therapy so they can participate in physical therapy. Otherwise, it's just too hot, you don't get anything out of it. So no question, no pain, no gain, but there has to be control of pain so you can tolerate this thing. So eventually this IT band does stretch. It doesn't tug on these things anymore. The swelling to these little bursa sacs go down in size and they shrink back down to original size, and the thing can move properly back and forth. So even if it's tight enough, you'll have tension pulling and causing shin splints too, believe it or not. Whether it's the Gerdy's tubercle that's inflamed, the IT band is tight, or problems with excessive high arches in the foot, both of them cause problems. So that, in a nutshell, is what usually happens with people who have hip pain, knee pain, ITB pain, but regardless, usually it calls on the cutting back of activity, the administration of some topical, like ialic Panaway or spray on magnesium, something internal like an anti-inflammatory or turmeric, maybe the magnesium orally so that you can help the muscles stay loose. Muscle relaxer is sometimes important. If this is really bad, like I had this problem at 13 miles at the 2010 marathon in Chicago. I walked the last 13. And actually that's what began my hiking career, walking that distance. But I needed a steroid hit. And sometimes steroids are necessary. They'll reduce quick inflammation at the sacrifice of you being on a steroid and not getting any sleep and getting a little anxiety or shooting up your sugar. But for the benefits, it might outweigh the risks of those things I just mentioned, so it might be worth it. Either way, it's up to your doctor to kind of figure out whether your medicines or whether your herbs or whether you're just manual therapy, massage therapy versus physical therapy. So good question, Eve.